guys good to go? All right, good morning, everyone. Let me just, okay. Setting our tax rate and establishing a budget are some of the most important things we do all year. You could say that that's our primary responsibility, certainly for me, one of two, the other one being managing emergencies and serving as the director of the Office of Homeland Security and Emergency Management. Given the size of our county and just the fact that we're responsible for the budget of a county government that serves almost 5 million people, it's a very, very important part of our responsibilities. My goal in today, and generally speaking, is twofold. One is transparency, and the other one is fiscal responsibility. And so I want folks to know that my priority today, as it has been over the past few years I've been in office, and as it is going to be today, is going to be fiscal responsibility. But it's hard for you all to verify that if there is not transparency. And the fact of the matter is, thank you, this budget process is a little bit confusing, and I want people to understand what's happening. So today, actually, first I want to explain how we got here. So think of the county budget like a debit card. Okay, it's a debit card, there's limited funding. Right now in Harris County, unlike what you would do at home, we are way past the money we have. In other words, our debit card is on overdraft. That is the best way and clearest way to explain it. So the kinds of costs that the county has right now can all be summed up in terms of maintenance costs, the funding that we need in order to continue the current services, which, as you guys know, are not enough in a lot of our areas, particularly in terms of healthcare services. We could always do more on flood control. We could always do better on maintaining roads, sidewalks. I don't have to tell anybody about that. So maintenance costs involved statutorily required costs. For example, the cost of maintaining our jail is going up. That doesn't mean that we're creating new investments in public safety. That just means that in order to maintain the standards required by statute, we have to put more money into the jail. If there are more people in the jail, we need more detention officers because there's a staffing ratio. And so when there are conversations about increased investments in law enforcement or public safety, a lot of that is statutory requirements. But because our debit card is already on overdraft, we are going deeper and deeper into the hole when we have to increase those investments due to statutory requirements. Then remember the fact that we're losing tens of millions of dollars, hundreds of millions of dollars in federal funding. So our hospital system, our public hospital system, Harris Health, the reason this is relevant to you, even if you have private health insurance and you go to a private hospital, is because Harris Health, Ben Taub, is one of only 2 level 1 trauma centers. If, God forbid, you or a loved one ends up in an accident, in an emergency, that's where they take you, is Ben Taub, the level 1 trauma center, unless they send you to Memorial Hermann one, but you know, it really is the luck of the draw at that point. So $400 million in Harris Health funding right now in jeopardy because of federal government cuts. That's an enormous amount of money, huge percentage of their budget. We're already overdrafted, so of course we can't find $400 million somewhere to make up for that. Not to mention so many other grants that the county receives across departments, whether it be public health, whether it be our community department that addresses issues like homelessness, whether it be veterans or others. There are grants that we're not sure if we're going to receive or not, and so those are services that we routinely pay for with federal funding that we may not be able to cover, and so either we're cutting them or we're going further deeper into the hole, and the second one really is not an option. Let me give you a specific example. Ryan White Council planning. So Ryan White program was created under President Bush to help serve programs for people living with HIV and AIDS. The first freestanding HIV clinic in the country is the Thomas Street Clinic here in Harris County. It's a point of pride for our community that we have been very thoughtful and effective in serving the community living with HIV and AIDS. It was created in 1990. It has served more than 15,000 individuals in the Houston area just last year. Federal funding will cause people to lose care, potential layoffs, delays in services. We only have a few years of budget left, and after that we don't have any more money to fund those programs, so the services will end. Now, the obvious question, which I would ask is, well, can't you find some efficiencies? Can't you find some cost savings mechanisms? And the answer to that is we have. Over the past few years, we have worked really hard to make county budgeting more efficient, to combine expenses where we can, to bring in people that are going to help us make cost savings possible. And even this year, we are looking at additional cost savings measures. And so today, there are some that are being proposed. And so let me go over what those are. That's this document, and we'll pass it to the press later. So it's the one with the longer table. So this is what are being proposed as potential cost-saving measures. Some of them, these are this year's measures that's in addition to what we've done in previous years. So as you can see, if we look at additional savings, those are some property sales, that is this pension and healthcare funds contribution. That's a conversation that's going to be had inside about whether to charge employees more for their county-provided health care. The PIC fund contribution, that's the rainy day fund. So the proposal is to not make an additional contribution to the rainy day fund this year. The contract patrol, so right now Harris County subsidizes the contracts that neighborhoods have with constables in order to provide additional security to their neighborhoods. So the proposal is to reduce that subsidy. The ARPA reallocation, so those are $20 million that will go from one-time federal funding to the general fund. In other words, it's kicking the can down the road. It is saying we're going to take one-time funding to pay for $20 million worth of recurring services. So that one really, I would say, doesn't really count. It's kicking the can down the road, and so on and so forth. So some of those are going to be voted on today. I, for one, am going to be on the side of austerity. My expectation, suspicion is that there will not be majority support for some of these cost savings because, of course, they're politically difficult. But there seems to be a trend on putting personal political interests above the interests of taxpayers. On the other side, again, you can see some additional strategies for cost savings. And so when you add all of this up, though, it still leaves you with around $100 million of outstanding costs. In other words, even after we do all of this, which I don't think we will do all of this today, we are still overdrafted in our debit card by around $100 million. And so the question is, okay, in Harris County, we're not allowed to have an overdrafted debit card. So how are we going to cut $100 million more dollars on top of the fact that we've already been cutting, and on top of the fact that we're expecting federal funding to not come through? And so unless we have some sort of magic powers that I don't know exist, we're going to have to cut department funding. And so why are we in this situation? You know, if we're able to do all of this, it's $100 million that we're cutting from departments. Well, you know what cost $100 million was the arrow that a majority of court threw at the heart of your county budget. It was a decision several weeks ago to commit to $100 million in law enforcement raises when we had the recommendation from the budget director and the clear understanding that we did not have that money. In other words, the debit card was already on overdraft, and then 3 colleagues decided, counter to the budget director's recommendations, that, you know what, we're going to put $100 million more into that. We have no idea how we're going to cover that $100 million. My plea at the time, just as it was last time, was let's go to the voters. Let's not cut $100 million worth of services without asking, hey, would you like to cover those law enforcement pay raises? Or would you like not to, in which case you'll keep all the services, and we'll have to cut the services, or we can do both if you vote for it. But of course, the decision was made to not go to the voters, to instead make the unilateral decision to put us $100 million in the hole. To put $100 million into context, that's around how much money it would cost to renovate the Astrodome, okay? So we could take that $100 million that was unilaterally decided to put us in the hole, send it over the Astrodome, we'd probably stop debating that. And so here's the other thing that I want to make sure you guys know. So there's actually on court today and the last court, on top of that, even more decisions to put us deeper and deeper in the hole. So today there's a proposal to increase the salaries of county elected constables. They've already received some raises. Of course, I'm not going to be supporting that again on the side of austerity. Last court, there was a decision to pay $5 million more for park security that was already being covered. So that's additional money that we're going deeper and deeper in the hole. So in order to pay the overdraft, we're reducing the main cost area, which is maintenance costs. There's a lot of smoke and mirrors going on. The people of the county are smarter than that. We all manage our budgets. We know that money doesn't grow on trees. If we spend more than we have, we're going to have to cut somewhere. And so let me just show you a little bit about what's happening here. The $200 million in the hole, that's about 9% of our total budget. And then, so how do you cut that? You know, some have said there won't be cuts to library or clinical health hours. Maybe, but there's ways that those areas are getting funding cuts. Again, because we have to find these hundreds of millions of dollars. So where else are you going to find them, right? There's a $700,000 cut in current vacancies at the library. So those are spots that the libraries was counting on that they're looking to fill so they can continue programs that now they're not going to be able to fill. Earlier, there was a statement that early childhood and apprenticeship programs will be continued through the end of the year. We're always going to do that. That's how long the federal funding lasts. So this is nothing, the request last year was to continue that by going to the voters, which of course we did not have support again to go to the voters. So this is not news. This is just the federal funding running out. Departments like the tax office, the DA's office, the Department of Housing, which again deals with homelessness and related issues, the Fire Marshal's office, implementing the fire code. Those are big ticket items that could face cuts. We're looking at, okay, fine, maybe we won't cut some clinics, but you know what we are cutting? Public health equipment, public health trainings, equipment for testing. And so, we've seen it with the federal government. You're cutting things, you're going to see those impacts in services. It's impossible for there to be no impacts when you're cutting $100 million, when you've already instituted cost savings, and there's hundreds of millions of dollars in federal funding that is no longer coming. It is impossible. And anybody who says otherwise is trying to pull the wool over your eyes. And so, maybe the clinic doesn't close, but instead of being able to see 25 patients, they see 20. We're seeing cuts to services for women and children, maternal and child health. We're looking at potential cuts to county efforts to train the next generation of the mental health workforce at a point where we have too many people needing mental health services and too few people providing them. As I said, we are contributing we're contributing less than usual to our rainy day fund. And so, we may say, okay, that's not a big deal because we already have money in the rainy day fund. But remember, this is a year where we can't rely on FEMA grants because the federal government has cut FEMA. They have threatened FEMA funding for governments. Certainly politically, the federal government is not aligned with the majority of Harris County, and we know a lot of this has become political. And so, fundamentally, what we're looking at here is, what do we do? So what's the answer? Do we fire our accountant? If this were your budget, you realize that you're $200 million in the hole, maybe you turn to your accountant, you say, hey, I don't need you anymore. Well, here's the thing. Our accountant, so to speak, is our budget director. Our budget director has advised against all of these commitments that have led to overdraft over the past year or so. Every time there has been an additional request, whether it be additional funding for courts, additional funding for salaries, additional funding for all kinds of things, the budget director has said, we cannot afford it, to the point that he's been ignored so much. Today, he's presenting these proposed offsets, but he's not making any recommendations officially. Our county administrator resigned in the middle of all of this. I mean, why would you want to be leading the county if those folks that are supposed to be listening to your advice routinely ignore it and put you $200 million in the hole? And so it's not that our budget director has not been advising us properly. It's that the buck stops with all of us sitting around the horseshoe. We make decisions. We decide whether or not to follow the budget director's recommendations. And so what I'm hoping my colleagues will do today, and certainly that I will be doing, is number one, to help minimize the damage. In other words, to follow these proposals by the budget director. And number two, at the very least, to not make things worse, to stop the bleeding, to not commit to giving more money. If they commit to continuing to subsidize the contract program, if they commit to increasing salaries for constables, that's continuing the bleeding. That is exacerbating the issue. And so, here, this table illustrates the issue we're in. So we are projecting a $133 million deficit. Then we had better than expected projections in terms of the county's financial standing. So it was going to be $108 million. Then the colleagues committed to $142 million in unfunded raises for law enforcement. That was money that we all knew we did not have. Two of us said, hey, let's ask the voters if they want to pay this amount of money, because we do not have it. We're at zero. In fact, we were already in the negatives. We negotiated for months. Now the cost of this unfunded raise is going to be $101 million. $100 million is a lot of money. And so in total, our deficit, the debit card that's on overdraft, it's $209 million. We've overdrafted by $209 million. That's more than the county budget for a lot of counties in Texas. Let me just tell you that. And so there are some offsets that are being proposed. Even if we were to do all of that, which I'm not sure my colleagues will support, we're still going to have close to $100 million that we have to cut from departments. And so, again, unless my colleagues can make money grow on trees, yes, there will be cuts to basic services because we've already streamlined everything there is. And so, the purpose of local government is to be agile, to be fully functional when you need it to be. And these cuts are going to hinder our ability to be responsive. So today I'm going to be voting on the side of austerity, but most importantly, I encourage the public to get informed. So today the decision is on whether or not to support these cost-saving measures that the county budget director is proposing. Then there's going to be a meeting coming up later in early September, where we're going to set the budget. So all the cuts are going to be firmed up at that meeting. And then there's going to be ultimately the decision on the tax rate for each of the entities. But remember, our hands are tied because colleagues decided not to go to the voters on this $108 million increase for law enforcement that we couldn't afford, that I fully support this pay increase. But if we can't afford it, we can't afford it, okay? And then there is the of course the early childhood program, which they also decided not to go to the voters with. So to me, very important to be aware of this, okay? Not only are elected leaders putting your county in the hole, but they are refusing to ask you whether you would like to pay to make up for this money or whether you would like to see cuts. We are forcing you to have cuts. Public health, pollution control, homelessness, maternal health, you name it. So let me leave it at that, and I'm going to repeat here in Spanish. And then I'll take some questions. Bueno, hemos estado trabajando en el presupuesto del condado Harris y hoy día vamos a considerar ciertas propuestas de compensación para poder nivelar el presupuesto que existe en este momento. Hoy día hay muchos costos, muchos compromisos del presupuesto que no han sido financiados. Específicamente, el condado maneja costos de mantenimiento para tantos servicios que ofrecemos. Y con todo y eso, yo sé que hay limitaciones en cuanto a la calidad de los servicios. Por ejemplo, yo sé que se necesitan mejores aceras, yo sé que se necesitan mejores calles, que hay que mantener mejor la calidad de nuestra infraestructura de manejo de inundaciones, etcétera. Pero solamente hay tanto dinero y con ese dinero pues hacemos lo que podemos. Entonces, el costo de mantener los servicios al nivel en que existen es un costo constante. Pero recordemos una cosa, que el gobierno federal ha estado cortando fondos drásticamente. Por ejemplo, el sistema de hospitales públicos, Harris Health, está proyectando $400 millones en recortes por fondos federales que ya no van a llegar. Ese sistema de hospitales públicos es importante para usted, aunque usted tenga aseguranza privada. ¿Por qué? Porque si Dios no quiera, está usted en un accidente de tránsito, en una emergencia, lo llevan al centro de emergencias en Bentov. El centro de emergencias de nuestro sistema de hospitales públicos es uno de solo 2 centros de emergencia nivel 1 en nuestro condado y en nuestra región. Entonces, encima de eso, hay más programas, bien sea en temas de salud pública, bien sea en temas de personas sin hogar. Casi que en todos nuestros departamentos hay programas que mantenemos año tras año con fondos federales que ya no llegarán. Específicamente, fondos, por ejemplo, para el VIH y SIDA. Es un programa creado por el presidente Bush en 1990. 15,000 individuos viviendo con SIDA y VIH utilizan esos servicios año tras año. Sabemos que esos fondos se van a acabar, que no vamos a recibir más fondos federales. Entonces, ¿qué va a suceder con todos esos individuos? Es un ejemplo concreto. Bueno, entonces la pregunta es, ¿y eficiencias? ¿Ya han analizado eficiencias? ¿Ya han analizado reestructurar los departamentos? ¿Ahorros de costos? ¿Qué se ha hecho? Bueno, hemos trabajado en eso durante los últimos 6 años, pero además hoy día se proponen más estrategias para ahorrar fondos. Son todas estas 2 páginas de estrategias. El problema es que hay ciertas estrategias que me imagino mis colegas no van a apoyar. Por ejemplo, ajustar el sistema de aseguranza para los empleados del condado, o sea, que los empleados tengan que pagar un poquito más por la aseguranza. No creo que se apoye eso. Reducir el subsidio de contratos de adicionales que ciertos vecindarios tienen con policías para ofrecer seguridad adicional. Uno imaginaría que el vecindario debería pagar por eso, pero la realidad es que el condado ofrece un subsidio. Entonces, acabar con esos subsidios es otra idea, que no creo que suceda, pero ya veremos. Una idea preocupante es no sumarle fondos a nuestro fondo de emergencia. Es el fondo que utilizamos cuando hay huracanes. En este momento tenemos alrededor de $180 millones en ese fondo de emergencia. Bueno, podríamos decir que eso es suficiente, pero este es el problema. En general, tenemos más de eso. Pero hay que recordar también que el gobierno federal ha estado amenazando enviar fondos, como normalmente hacen, a través de FEMA, de la Organización de Emergencias. Entonces, este no es el año para no contribuir al fondo de emergencias por si hubiera un huracán o 2. Lo otro que quiero explicar es, ¿por qué están diciendo ciertas personas que no habrán recortes? Eso es simplemente no es la realidad. Aunque hagamos todos estos recortes, el condado aún queda en un déficit de $100 millones. $100 millones es el presupuesto de muchos condados. $100 millones puede ser lo que cuesta renovar un estadio. Entonces, ¿de dónde vamos a sacar $100 millones si tenemos una tarjeta de débito en donde estamos en los negativos? Negativo $100 millones. Entonces hay personas que dicen, bueno, no van a haber recortes de salud pública, no van a haber recortes de tal cosa. La realidad es que sí los van a haber. Puede que las clínicas no se cierren, pero van a haber menos pacientes. Puede que no se despidan empleados de la clínica, pero sí va a haber menos entrenamiento, menos equipo. Van a haber recortes en otros departamentos. Ya han habido despidos de personal. Entonces, obviamente, van a haber impactos porque ¿de dónde más se sacan 100 millones de dólares? Lo siguiente que uno diría, bueno, ¿por qué no despedimos al director de presupuesto? ¿Cómo nos permite él estar en un déficit de 100 millones de dólares? O sea, hay que contratar a alguien distinto. Bueno, la verdad no se le puede echar la culpa a él, porque el director del presupuesto nos ha dicho durante los últimos año o 2 años que no nos alcanza el dinero para pagar por todo esto que los colegas se han comprometido a pagar. Específicamente han habido compromisos de incrementos de salarios, de incrementos a ciertos departamentos, pero el más grande fue un compromiso de subirle el salario a los policías en un monto que llega siendo más de 100 millones de dólares. Miren, yo creo también en tener policías bien pagados. Es una profesión muy importante donde necesitamos los profesionales más equipados, pero si no hay dinero, no hay dinero. Entonces, cuando hubo la propuesta de subir el salario por 100 millones de dólares, dijimos, mire, el director del condado dice que no nos alcanza, que estamos ya en negativos. ¿Por qué no le preguntamos a los votantes si quieren ver esos 100 millones de dólares o si prefieren que recortemos los servicios básicos? No hubo apoyo en la Corte de ir y preguntarle a ustedes los votantes. Entonces, ahora estamos forzando estos recortes masivos. Les quiero explicar mi estrategia hoy día y lo que espero que hagan mis colegas también. Uno es minimizar el daño, o sea, seguir las recomendaciones del director del presupuesto para poder ahorrar unos fondos. Número 2, no empeorar las cosas, no hacer más daños. Hay 2 propuestas el día de hoy, subirle el salario a ciertos otros policías. Ayer, la semana pasada, se subió los fondos que se invierten en los parques, o sea, estamos ya en negativo 200 millones. ¿Cómo vamos a seguir gastando fondos que no tenemos? Espero que los colegas no hagan eso. Como he dicho, bueno, hay muchos retos. Puede que algunas personas digan que no van a haber despidos, que vamos a ver cómo se soluciona esto, que tenemos fondos que no tenemos. La realidad es, estamos a un negativo 200 millones y aún que si aprobamos todo hoy, aún van a haber 100 millones de dólares de recortes. Entonces, eso era lo que les quería explicar. Hoy día vamos a hablar de estos potenciales soluciones para ahorrar alrededor de 100 millones de dólares. Aún faltan otros 100. Y en las semanas que vienen se van a aprobar los recortes a los varios departamentos y también la tasa de impuestos para los residentes del condado Harris. Entonces, lo dejo ahí, seguiré velando por la transparencia y la responsabilidad financiera del condado, ya que es un deber importante como juez del condado, tanto manejar las emergencias como manejar el presupuesto. I'll take some questions now.
Judge, why should taxpayers trust Commissioner's Court? You're saying one thing, your colleagues are saying another.
I think, people should look at the numbers, right, and look at the past meetings of Commissioner's Court. It's clear as day. You can see the recommendations that the budget director has made over the past few meetings of court, and I'll have my staff pull it. And you can see that he says we cannot afford it, and 3 people around the horseshoe vote for it anyway. And you can see that 2 of us propose, let's ask the voters before we make cuts, and 3 of us say, no, let's just make the cuts. So that's just what it is. If I had put the budget in the hole, if I had put taxpayers in this untenable situation and disenfranchised them, I might also try to obfuscate a little bit. You can understand that. But the fact of the matter is, it's dollars and cents. You'll hear it from the budget director today. We have $200 million that we have to make up for. That is a fact. The federal government is cutting grants. That is a fact. We all know that. The federal government is attacking FEMA. That is a fact. And then we know also that there has not been any effort to go to the voters to ask to cover these costs. That is also a fact. So I'd like to see them show me where they're growing money on trees. Other than that, I'm not asking for any leap of faith in explaining the facts. I'm simply walking people through the numbers.
And your colleagues kind of suggest that situations aren't as dire as you suggest, saying that they've looked at the last few months ways to make smart cuts or efficiency rather than cuts. But the vacancies, they say, instead of filling it and replacing it, it's been vacant for over 100 days.
That may be for a few vacancies, but certainly not most of them. And again, I think that they listed maybe $1 to $2 million worth of savings if you add up the departments they mentioned. We have $200 million worth of savings we have to make, and so. You can listen to the budget director, you can look at the numbers, or you can listen to the folks that have been committing money that we literally don't have and have refused continuously to go to the voters, instead trying to obfuscate by pointing to other issues. And so, when they say there's going to be no impacts to clinics, that's categorically false. When they say there's not going to be impacts in terms of firings, that's categorically false. There are departments that already have made layoffs in preparation for the budget season. So, if they can explain to you guys how it is that they're saving the $200 million, where the plant is that grows money on it, color me surprised. All right, thank you so much. Yeah.
It's been a week since the penny tax vote. How are you feeling about all of that? Are you worried that some of the coverage of that and the censuring could put that program in jeopardy moving forward?
The program, it was killed already by my colleagues, so that's another one. But yeah, that's we had an opportunity to continue childcare. The vast majority of voters, 2/3 of voters, wanted an opportunity to vote on that. And again, who are we going to trust? The folks that don't trust you to make a decision, or the folks that are trying to fight for children? I don't even have children. It's the future. So anyway, let me leave it at that. Today, I think the focus is the budget. But again, both the child care program and the apprenticeship training program are ending next year. That was the plan. That's not, they're not extending it to next year. So here's an example of how they're twisting the facts. And that's just, to me, it's not going to happen without me trying to clarify for the public what's taking place. Because ultimately, the way I look at myself in the mirror is by knowing that I'm telling the truth and that I'm not putting my political interests before anything else. It'd be very easy for me to say yes to everything. That's a lovely thing to do. Yes, increased salary increases. Yes, more pay for these. Yes, more services here. More money for parks. Everybody loves to say yes, but as elected officials, we have to be able to say no sometimes, because otherwise we can't fulfill our budget. It's as simple as that. All right, thank you.